There was a small team of us who were driving incredibly hard and getting blocked. For instance, I was trying to publish the recommendations on likely actions we might have to take in terms of lockdown and getting blocked by Number 10 from doing that, which eventually went out in early March. And this is just another example of it. I cannot for the life of me understand why PHE would make a statement like that when it was so clear that we were running into a major problem. And it is a deep frustration that even as Secretary of State, I couldn't get them to change their clinical guidance.
Can I just ask, I'm sorry if I don't really follow how PHE was an independent agency but responsible to the Department of Health and Social Care?
Through the CMO, yes. And I spoke to the Chief Executive.
So why doesn't the Secretary of State for Health and Social Care have any levers over PHE?
You may very well ask, because of the behaviour of some of the senior officials. So, for instance, when I said in January, I want the serum that we have to be made available to the private sector so they can expand testing, they didn't do it, right? It's astonishing that we haven't got PHE senior officials at this inquiry, and they've essentially not been asked these questions. It was a enormous... I'm afraid
we have had officials from Public Health England and UXA, Mr Hancock. So.
No, these questions have not really been aired. I don't care if people get upset about it. You know, we've seen even from this very chair, people who were upset about me taking action that was necessary. I ruffled some feathers. They were rude about me at the time. They've been rude about me since, but it saved lives, and that was my duty as Secretary of State.
Can we come back to the document?
That's what it says.
Can we come back to the document, please, and look at the fourth bullet point down. The Secretary of State flagged the most contentious item in the bill, which I assume is the coronavirus bill, is to raise the threshold for giving care. It's a very complicated set of problems. Are you able to briefly explain to us today what it was that was being proposed in relation to raising the threshold for giving care?
Yes. So this is a question about a measure in the bill, the coronavirus bill, to say that care should not be given for those who are who there is a judgment that it's a measure in the bill that says essentially for rationing care. We did not execute this measure. It's very important to state that. And it was against policy to either have do not resuscitate orders without proper and due consent.
You said in your statement, in fact, that NHS England insisted on the policy.
Yes.
And you later in your statement said, although I did not take the decision, I take responsibility for it.
Yes, for two reasons. The first is it was a decision of the government, and I was the Secretary of State. And I take responsibility for all of the decisions in the area that I was responsible for. The second is that whilst this is obviously an incredibly contentious issue, as I also said in my statement, nobody has yet provided me with an alternative that was available at the time that would have saved more lives. There are things that we can do now, and indeed should have been doing for the last 3 years since this inquiry was set up, to make sure we're better prepared, and we went through some of those right at the start. But obviously, having racked my brains about this and thought about it incredibly hard, and in preparation for this inquiry, having gone through all of the paperwork, I still can't see a decision that would have been less bad. None of the options were good.
No. Do I take it that it was, from your perspective, the least bad decision, the least worst decision?
That's exactly my view, is that it's the least worst decision that could have been taken at the time.
But it was a decision nonetheless that you agreed with at the time?
I accepted it. I wasn't the driving force, but it was the decision of the government, yes.
I'm just trying to understand, if we don't have testing, there is an inadequacy of PPE. You can't isolate. and the advice doesn't say isolate, you're not banning staff. What was the protection for the care homes, Mr. Hancock?
The question we faced was, what is the best policy?
That's not what I asked you.
It may not be what you asked, but it is the question that was valid at the time. You see, if you take these questions out of context, then you are not asking the real question that we faced. The protection, at the time, was clearly not as much as we would have liked, but the alternatives were even worse.
Now, you say it was not as much as we would have liked, but what was it? That's what I'm trying to understand.
Well, we started the flow of free PPE. We were testing those with symptoms.
Yep.
We were not testing asymptomatically because of the clinical advice and the shortage of tests. The expansion of testing, which we were in the middle of, which we expanded rapidly in the days following that announcement, and in particular over the month of April, these were all the protections that we were putting in place. We were trying to put as much protection in place as possible. And all I can do is take you back to the actual decisions and the resources that we had at that moment. We did not have enough. We did not have enough, right? The preparation had been inadequate. The department, I had taken the decision to take responsibility for a series of things that had not been done. I am held accountable for those actions. But the actions, I've reviewed every piece of paper in preparation for this module. And what I can tell you is from the moment we gripped this, we started one by one solving these problems. You do not have to tell me how great the challenges were, how little protection there was for the public. There wasn't enough PPE there wasn't enough testing, right? There wasn't enough PPE. We didn't have the right, the public health authorities had the wrong attitude and the wrong doctrine. Okay, all of these things needed fixing, and one by one, we did everything we could to fix them. The challenge we have now is to say what is ready for next time.
You needed isolation and testing and PPE.
Yes, and I went on to build all those things. Exactly, yeah.
Finally, on Nimbus, there appears to have been discussion about staff absence in the healthcare sector with respect to communication about it, but no discussion about staff absences in the adult social care sector. Why was that?
I don't know whether that's the case. As I say, it was a Cabinet Office prepared paper. So ultimately, Exercise Nimbus was in my view, the end point of the approach of embodied in the 2011 strategy. If you remember, a few weeks before this, I'd been calling for Cobras, trying to get action, been blocked by the Cabinet Secretary. They'd been quite rude about me, and they continue to be rude about me.
Let's not worry about that.
No, it's important, because what I'm trying to get you to understand is that Exercise Nimbus was based on the wrong doctrine. It was the moment for me that I thought, we cannot let this happen. And then there was a whole load of action that went from it. So that's my explanation for why certain things aren't in there that really, in a future exercise, absolutely should be.
Okay, I'm not going to take Nimbus any further with you. The point I put to you is that the problem about the proposal that was being put to you, you're chairing it.
Yes.
These are the minutes. They're not the Cabinet Office briefing document. These are the minutes of it.
Yes.
There's nothing in there about all the measures that you say you agree should have been taken thereafter, and this is 12th of February.
Yes, and my response to that is that all you're doing is reinforcing the point that I would make in response to Nimbus, which is the exercise highlighted the wholly inadequate attitude that was being taken by the Cabinet Office to how to respond to a pandemic.